Thank you, Mr. Chairman. Congratulations on your chairmanship. It's good to be on another committee with you. Congressman, welcome. I really enjoyed our conversation. I'm not going to speak further on privatization of VA and my opposition to it, you know. I think that you would agree, would you not, that VA is uniquely suited to provide the highest quality of health care to veterans, and that privatizing VA would create a significant challenge wherein veteran care would be outsourced to providers not equipped for this specialized training, directly impacting the quality of care afforded to veterans.
Senator, again, it was good to talk to you. You would not believe how many times I've used our conversation in discussions with SVAC and other things, so it's been good to see. Of course, I mean, I think when you look at this issue, that the VA is uniquely positioned to deal with veterans and has the data, which you and I talked about, that can provide not only help for our veterans currently in the system, but even outside the system, using that data then to help others outside. We have a unique control group, if you would, that can actually look at that. So I think with someone we can definitely continue to work on. And as I've stated before, there'll always be a VA health care center for those veterans that come home.
Yeah, just keep VA the medical center home, and then if they need care for their specialized treatment, they can go somewhere else. But as long as the VA know what's happening and is keeping track, I think that's really important for the veterans' best health.
I think as we do it efficiently and appropriately, and we make sure the veteran is the center of that, that's exactly what we need to do. You and I mentioned this, that I think we need more the issue of women's veterans coming in, which are a large population of our veterans coming in now, making sure that if they want to receive that care in the VA, for instance, right now there's depending on discussion, lack of mammogram equipment. Those are things that are at large VAs who satisfy a large number of female veterans. They're having, to do that. If they wanted to stay in, they couldn't. So I think working it both ways is where we need to be.
Yeah, I think the medical, what is the best medical treatment is where we need to go. I mean, in the case of mammograms, you need somebody who reads thousands and thousands of mammograms, and if you only take care of a small number of female veterans, I wouldn't want to have my mammogram read by someone who only reads 100 mammograms a year, as opposed to a partner organization like that rural hospital or somebody who reads thousands of mammograms so that they can better spot any problems.
Exactly, and that brings me to, I'm going to sort of maybe jump ahead of you a little bit. I think it goes back to your discussion we had in the office about the SVAC and the rural hospital issue, that they could, and I think what you made was a very good point. And I'm going to take it a step further about what you just said, though. It's the sharpening of skills. For those of us who've been to Iraq and have been to Afghanistan, we saw trauma and emergency care at its finest. Yes. I mean, if they came through the Heroes Highway at Balad, 98% of those made it back home alive. Now, some of them didn't. You were one that didn't. There's some who didn't, but they got back home. And I remember the time that I sat with a young man who I was with him and prayed with him, and he had I'll never forget him because he had blonde hair, blue eyes. And I went back later that evening, and he was gone. They had already got him on a plane and got him later. A week and a half later, I looked at Stars and Stripes, and I saw his picture. But I was comforted by knowing he was back home when he passed. That is sharpening of skills. And in the VA, we need to have that. We have to make sure that our veterans are getting that same kind of treatment so that our skills and their treatment are matching.
Wonderful. Thank you. If confirmed, will you commit to working with myself and my colleagues on this committee to strengthen and refine VA policies that improve wait times and access to VA health care rather than resorting to privatization? Yes,
I think that is what we're looking at right now is a VA that has the VA healthcare system, and again, it goes back to the service of the veteran. Mm-hmm. And if anytime, I'll say it again, I've said it before, I'm going to say it again, when they have to call my office when I was in Congress or your office now, that is a failure from the VA. And it's not a failure on the people. So for anybody try to twist what I'm saying, that's not what I'm saying. The VA has a mission to take care of veterans. If for some reason the veteran's not able to get that care, then we need to step up and make sure they answer why. So yes, trimming down wait times, making sure they get that, because some of the things we could be missing are preventative care that could actually help us long-term in our cost perspective if we're catching it early.
Yeah. Thank you. I'm glad you mentioned preventative care. Right now, preventative health care is something that patients in the Affordable Care Act or other places do not have to pay for their preventative care. So your prostate cancer screening, your mammograms for breast cancer, colon cancer screening, your statins for your cholesterol medication, you don't pay a copay for that, but veterans do. Would you, if confirmed, will you support making a non-controversial common sense fix to ensure that VA coverage aligns with that of commercial health care and TRICARE? And help me eliminate the copays for veterans for preventative health care?
I look forward to working with this committee on that because I do believe, as you do, that the preventive aspect of that is very important.
Thank you. You're back, Mr. Chairman.